Thank you, Mr. Chairman, for the opportunity to testify today. I am here this afternoon to request that funding be restored and increased in the 2012-2013 Commonwealth budget for the Pennsylvania Tourette Syndrome Alliance. I'm here to request the very nominal amount of $150,000 be put back into the budget to fund the critically important programs and services provided by the Pennsylvania Tourette Syndrome Alliance. The Pennsylvania Tourette Syndrome Alliance is a nonprofit agency based in Adams County. It serves as Pennsylvania's own chapter of the National Tourette Syndrome Association. This organization provides very critical services to Pennsylvanians who suffer from Tourette syndrome and their families. Tragically, the governor's budget proposes to zero out this line item altogether. I'd like to note that our neighboring state of New Jersey funds the same Tourette syndrome mission to the tune of $1 million, while our own Commonwealth is proposing a total elimination of this funding that assists families who are struggling to cope with this disorder. Mr. Chairman, in all honesty, the original $100,000 appropriation was not adequate, and the governor's plan to totally eliminate funding for the Pennsylvania Tourette Syndrome Alliance will have a devastating effect on their mission. Without restoration of this funding, simply stated, the Pennsylvania Tourette Syndrome Alliance will not be able to properly advocate for Pennsylvanians who suffer from Tourette syndrome. The mission of the Pennsylvania Tourette Syndrome Alliance is to identify and to support the needs of and to advocate for individuals with Tourette syndrome in the Commonwealth and to promote awareness of Tourette syndrome through informational outreach and educational presentations. The Pennsylvania Tourette Syndrome Alliance provides services for those with Tourette syndrome, their families, schools, the medical community, and the general public. The Pennsylvania Tourette Syndrome Alliance represents 9,000 families and their children who are enrolled in Pennsylvania schools. Mr. Chairman, I think it's important that I describe what exactly Tourette syndrome is. Tourette syndrome is a neurological disorder characterized by uncontrolled tics, involuntary, rapid, sudden movements or vocalizations occurring repeatedly and frequently, such as excessive eye blinking, coughing, throat clearing, sniffing, and facial movements. In its more severe form, victims may bark, use profanity, or make other awkward social comments or sounds. Tourette syndrome affects between 3 and 10 in every 1,000 children, based on the new prevalence study by the National Institute of Health. Thousands of public school children in Pennsylvania have been identified as having Tourette syndrome. Many more, sadly, go undiagnosed or have chosen not to be identified at all for fear of being stigmatized. Mr. Chairman, Tourette syndrome is a very complex disorder and often co-occurs with other disorders such as attention deficit disorder, attention deficit hyperactivity disorder, obsessive compulsive disorder, sensory processing disorder, and a variety of other learning disabilities. Tourette syndrome, with its spectrum of associated disorders, is multifaceted and is often misunderstood. Together, these diagnoses make coping in school a tremendous challenge. Until their teachers and classmates understand or are trained, many children with Tourette syndrome are reprimanded in school or tormented by peers for their symptoms, which are caused by their disability. The funding in question empowers the Alliance to provide supports and services to Pennsylvania residents diagnosed with Tourette syndrome and their family members. Services provided include information and referral, outreach program, a dynamic website, a toll-free hotline for parents, teachers and caregivers, for parents, teachers, and caregivers, newsletters, support groups across the Commonwealth, non-legal advocacy, and an annual family conference. The Pennsylvania Tourette Syndrome Alliance also provides information and training to schools, teachers, counselors, coaches, nurses, physicians, professionals, speech pathologists, family members, and peers. To help the community at large, the Alliance provides training and sends outreach to the underserved areas of the state, including our most rural and remote communities. The Alliance also maintains a physician referral list of doctors who specialize in Tourette syndrome so that families who are seeking an appropriate diagnosis and treatment can locate doctors familiar with the disorder. Mr. Chairman, the Pennsylvania Tourette Syndrome Alliance utilizes the funds they receive from the Commonwealth prudently. Their mission includes a small staff who manage a cadre of numerous volunteers who provide toll-free phone support to families across Pennsylvania. The advocates of the Alliance drive thousands of miles every year throughout Pennsylvania to attend school meetings and to give educational presentations. The advocates travel almost weekly to Philadelphia to help Pennsylvania's poorest families get the help they need to care for their child and to ensure the best possible educational setting. Many parents need assistance in navigating the confusing IEP process, and as part of the IEP team, Alliance advocates are able to help school districts to better understand students with Tourette syndrome and to make recommendations for the modifications that will help these students to be successful in school. Sadly, many students with Tourette syndrome have been suspended from public schools, placed in alternative schools, or not correctly identified for special education services when no advocates are involved on their behalf. Mr. Chairman, the most compelling reason of all to restore full funding to the Pennsylvania Tourette Syndrome Alliance is that they advocate for families who have no other place to turn. The families to whom I refer cannot afford legal counsel nor professional advocates to fight it out with their local school districts and desperately need the Pennsylvania Tourette Syndrome Alliance to advocate for them. The Alliance is out there fighting for these families and is most deserving of our support. Mr. Chairman, a fair question about the funding is what will happen if the state does not fund the Pennsylvania Tourette Syndrome Alliance next year. I can tell you with all candor that the loss of this funding will have a significant negative impact on the services that the Alliance will be able to provide. The Alliance has already condensed its services, reduced its programming costs, eliminated staff positions, and exhausted its modest reserve to cover last year's funding cuts. Without state funding, the Alliance cannot continue to meet the needs of families affected by Tourette syndrome at its current level of service. If the Pennsylvania Tourette Syndrome Alliance is to continue to provide these vital services without state funding, at this rate, the organization will last no more than 7 months before it will have no choice but to close its doors and end its mission. Mr. Chairman, I conclude my remarks by stating that if funding is fully restored to the $150,000 level, the Alliance will be empowered to continue their mission to support the children in the Commonwealth who have Tourette syndrome and the families who care for these children. I am respectfully asking for $150,000 out of a $28.44 billion budget to help children who have a disability. I'm sure beyond a shadow of a doubt that if we put our collective mind to it, we can find this critical funding. I am respectfully requesting the restoration of $150,000 to the budget for the Pennsylvania Tourette Syndrome Alliance. Thank you for your consideration, Mr. Chairman.
Thank you very much for being present today, Representative. Thank you.
Thank you to the members of the committee.
Yeah, Representative Murt, just to let you know, I personally will do everything I can to help you support this. I'm sure that Chairman Adolph, I think, feels very strongly about this as well. And I would, pledge that our committee members will work very hard to try to restore this funding and get you what you need.
I appreciate that, Mr. Chairman. And just one final thought. I think the best way to look at this, Mr. Chairman, this is an investment. This is not an expenditure. So thank you.
We understand.